ago. And it's for the attention of the managing director, Mr. Yao Kwakwa of the Ghana Airport Company Limited. The heading is Re-Alarming Rate of Positive Cases Arriving into the Republic of Ghana. It says, and I quote, "We write in reference to our letter dated 21st of April 2021 with the above subject to bring to your attention once again the unprecedented rate of positive cases being recorded at Kotoka International Airport. Today, 24th of April 2021, we recorded 75 positive cases. This exceeds the previous highest rate of 45 positive cases on the 21st of April 2021. We once again appeal to all stakeholders to implement stringent measures on the quality of PCR results acceptable for entry into the Republic of Ghana. It has become imperative to implement new guidelines to curtail the influx of positive cases into the country. Please find details of today's daily records attached. We trust our request will be given the urgent attention it requires. Please accept the assurance of our highest regards." And it's signed Dr. Kujo Senyaja. I hope I've said that right. He's the managing director of Frontiers. So this is the reality we're faced with. Now, Dr. Patrick Kumar-Boakye joins us on the phone. Doc, good morning and thank you for your time.
Good morning.
So perhaps we can... Yes, indeed, yes. Perhaps we can start with this letter from Frontiers. Did they write to the Ghana Health Service as well?
Well, no. I mean, it's all the address. It was addressed MD, and I believe that for me, that was really it's a lab.
We apologize there. I think our connection to Dr. Kumar-Boakye is a bit problematic. We're going to re-establish that connection so that he can give us some of the information that we are seeking. So we'll call him back and then reconnect with a better line. In the meantime, though, let me come to you, Dr. Bayo. One of the questions that is on our minds, bearing in mind the fact that these people who have tested positive at the airports are coming from other countries. I'm wondering whether we are starting to see a reflection of these high numbers in our communities. Are we seeing any spikes? Are we seeing any variants in our hospitals from according to your members? I think we may have a frozen line. Dr. Bayo?
Yeah, hello.
Yes, we can hear you.
Good morning.
Yes.
Yeah, good morning. Well, at the hospitals, I don't think that is a picture we are seeing. What we are seeing in the hospital is pretty much what we are seeing at the national level, which is suggesting a downward trend in the cases being reported. So what we are seeing at the airports is not exactly what we are seeing at the hospitals.
Okay. So that means these people, we are yet to see them making their way into the communities and infecting people. But tell us, at the moment, one of the big concerns is that our vaccination drive has come to a halt. Now, the numbers are on a downward trend, which is good, but how important is it that we get the vaccinations back up and running?
Well, I would say that to me or to Pami.
Oh dear. Dr. Bayo, let's see if we can strengthen that connection. But I'll put the same question to you, Dr. Kwame Sarpong-Asiedu. You've been keeping an eye on the vaccination situation globally. India seems to be quite literally on fire. Ghana's vaccination, though, has come to a halt. Is that a threat, or are we okay with our downward trajectory of cases?
Well, Kojo, thanks, and good morning to your listeners. If you look globally and you see the waves we're going through, you realize that no country, and I repeat, no country can get out of this pandemic with containment and protocols alone. It's pretty clear. If you look at the current trend, take out India, whose Prime Minister Modi declared about months back that they had conquered COVID-19. You can take a look at Thailand now, and you realize that Thailand, which was touted as one of the best countries to have managed this pandemic, because it's next to China, didn't have a serious first wave or second wave, is getting an uptick now. The only country that so far has opened up totally, to some extent, is Israel. And you know their numbers when it comes to vaccinations.
Yeah.
And with that opening up, they are not getting a surge in numbers. Similarly, the UK is all but opening up, albeit gradually. And the numbers are not going down, are not coming up either. They're actually going down, with mortalities virtually going into single digits. And Kojo, if you're talking about mortalities in the UK going to single digits, you have to look at it that just 3 months ago, you were getting 2,000 a day. So that tells you that mortalities have come down by about 95, 96%. So yes, I mean, and yesterday, Bill Gates, on the anniversary of COVAX, gave an interview that I monitored. And he also said that, look, nobody is getting out of this pandemic without vaccines. So our vaccinations slowing down is a concern. But that said, is it something we can do? Is there something we can do about it? In my view, at the moment, no. And I know listeners wouldn't want to hear something like that, but the reality, if you listen, if you even listen to COVAX, if you listen, there's an article in the Economist magazine, which was released on Saturday, which actually quotes our health minister, who was interviewed for that article. And he clearly says that they are not getting anywhere. He's had about 50 meetings, and they are not getting anywhere with vaccine bilateral collaboration. And for me, that was poignant, because this is our health minister, and he's having the meetings, and he's telling the world we are not getting anywhere. So can the government do anything about it? No, until the vaccine supply chain is corrected. And this is the position some of us have held for over 6-7 months. And it's rather unfortunate that the world has come to this point where we realize that the vaccine supply chain has to be corrected. And until it's corrected, and initially, I felt it would be corrected by Q2. But with what's going on in Israel, in India, that is a bit of a challenge. But I'll leave that here at the moment.
Right. Do we have Dr. Kumar Buaji back on the line? Hello? Do we have Dr. Kumar Buaji on the line? Not yet. Okay. We're seeking to reconnect. But I think our connection to Dr. Titus Bayo is a bit better. So, Dr. Bayo, let's look at it this way. Since we're talking about vaccinations, and the indication is clear, it's going to be a while. Tell us medically, what's going to happen to those who have received the first dose? At some point, will that first dose expire? Will they then have to get another first dose? And what is the time frame on that, if that's the case?
Well, thank you, and apologies for the terrible connection earlier. So expire, that would be a difficult call, but definitely what will happen is that the immunity may begin to wane if we do not get a second dose as planned. Well, that area of science is also a bit evolving, because these vaccines are now being studied. But the original dossier put out by the pharmaceutical companies and those who've done studies on this, it suggests that a single dose gives you some protection, and there's an optimum window within which, if you get the second dose, that protection is boosted and sustained. How long, I think, is still an area of research, but definitely, as originally planned, that second dose is necessary. But in the absence of it, it doesn't mean that you don't have any protection at all.
Right.
But, there will be a falling trend. How soon that will be, I think, is something that is subject to studies.
Well, we now have Dr. Patrick Kumar Buaji on the line. We apologize there. The line wasn't very good earlier. Thanks so much for your patience. So you were explaining to us about the letter. You said that the Ghana Health Service did not receive it?
No. I think in the first place, I still wonder why such a letter was written by a lab. We do a report, and immediately the next 30 seconds, every result is reported, which is part of Ghana Health Center. So we follow the report every and respond appropriately. So I really don't see how the labs should be writing systems, but that's okay, because the intervention they're seeking, the lab itself is part of the interventions that is there, and that is what justifies the reason why such a system was set up. Despite the negative to PCR test, you still have the test on arrival to be able to reduce importation. And then other measures already in place. So, well, it's fine for them to have written, but really, that is not the place of the lab to write such letters to us.
Okay. Well, they actually ended up writing to the Ghana Airport Company and not to you.
Yeah, but their report comes to Ghana Health Service. Ghana Airport Company, what measures are we going to put in place? Ghana Health Service runs the port health.
Yeah.
But I think let's move into something else. But I think it's out there, and so that is the issue.
Okay.
But we are apprised with information every minute that there's a test, so we know what minute, and we follow the trends, we follow the positivity, and respond appropriately.
Okay, so 75 positives in a day, that's problematic. What's the plan? What are we going to do about it?
Well, in the first place, the measure is to reduce importation. That's why the first time the airport and all the borders were closed, reduce importation. Open to set up systems like negative PCR before you're in plane, and then a test on arrival. And so with that, what it means is that we're able to significantly reduce the importation of the virus. So what it also means is that in the last 3 years, on Wednesday, we had about 45 cases. We dropped to a few, 15 or so cases. And then we jumped to the 75 cases. Yesterday was 3. All these people are currently being detained. And that policy has been in place for almost the past 2-3 months.
Right.
Where all those who are positive on that before, where you are asked to self-isolate, you are detained until you are negative. We have introduced what we call the panavirus to check the authenticity of the lab reports we bring, especially the negative PCR, to ensure they're coming from a recognized lab and it's not a fake one. So all these measures are already in place to reduce the number. And of course, this system was set up to respond to surges. And when you had in January, February, when you had the surges in Europe and others, the numbers went as far as 230 in January alone.
In a day?
No. Total for the month.
Oh, right. Okay.
Okay. So it depends on where the planes are coming from, and on a particular day, you could have more. Like yesterday, we had 1,200 plus passengers coming to the airport, but we only had 3 passengers.
Right.
So it depends. The dynamics are not just that one dump and then you skip to draw conclusions. But of course, the number we have recorded so far exceed what we had the whole of March. But that is in response to the fact that there's outbreaks in India and other parts of the world, also in Ghana. And that is why there's a system not set in place. So all those people have been taken out, they have not been able to enter. The next measure we are doing now, which we decided a few weeks or so ago, is that even for those who are coming, we ask them, of course, that one already, we ask them to self-isolate. But now we are going to follow them up with some tests to see a few days after whether they are still negative because of where they are coming from. And those are the kind of measures we are not taking place. So we're charging them, those who are sick are put in hospital, those who are not sick are put in some of our isolation centers. And they are helped to see them until they are negative, and then they are allowed to go. So those measures already exist to reduce importation.
Okay, so you're saying that for some people, there will be another test 3 days after they arrive, even if they are negative at the airport.
Yes.
Okay.
For example,
which countries would that apply to?
Well, I don't think that one is for radio. You communicate with them, and we'll follow them up.
Oh.
You and have.
Okay.
Those, if somebody is positive by your side, you identify somebody who sat next to you and turns positive. You may be negative, but we need to follow you up.
Right.
Okay? You have people who have come from certain periods, so their risks are high because the incubation period is 240 days. We have decided that for those who follow up, the Greater Accra used to follow them and call them routinely to see how they are. But now we are adding a test to see whether they are still okay or not, just to ensure that those who will turn out later positive are identified quickly. And like I said, all measures in all countries in COVID is not risk elimination, but risk reduction. Through the PCR test before and planning and the test at the airport significantly reduces in population.
So for those who are coming from the countries that will be affected by this, extra test 3 days later, should they not know this in advance, before they travel to Ghana?
They know. We have all their numbers. They inform and follow them up. This is not something new.
Okay.
Follow up on people who have arrived. The last time we did that, we have followed up 35,000 people across the country. So it's nothing new.
So if those countries, so if those countries are aware, then you can tell us on the radio, can't you?
Oh, I am saying that the country can change tomorrow. It depends on your status as such. And so for us, I don't think it is. You know where the hotspots are in the world. And so we get extra caution, not only for us, but also for their own sake, to follow them up for their own health.
Okay. So let's talk about the 75 that were recorded a few days ago. How many of them were Ghanaians?
Well, a larger number of them are Ghanaians.
Okay.
Who are returning after travel or return from hospital. A larger proportion are Ghanaians.
Which countries were they coming from?
Well, some of them are coming from Emirates, ET, etc. But we have their countries of original departure, and we are following them up. Some are coming from India, some are coming from UAE, etc. So we follow them up, and the numbers were proceed to change by regions, by day. So we also follow those who feel are high risk, and we are following them up.
Right. If you just joined us, we're talking to Dr. Patrick Kumar-Boadjeh. He's the Director General of the Ghana Health Service. We're talking about the increase in numbers of positive cases being recorded at the airports, where Frontiers is running the testing system there. So, Dr. Kumar-Boadjeh, you said that those who have been found to be positive have been isolated.
Yes.
Okay.
Either those who are sick are in the so after triaging feel they need some medical attention some are in isolation centers, some are in hotels where health workers are there to oversee their welfare, and we do their test after 5 days. On the 5th day to check the status again and see those who are negative by discharge and follow those who are sick.
Okay. So it appears that Frontiers has a suspicion that the quality of the tests that these people are bringing in, there is some suspicion that the tests are not of the best quality.
Well, I think that suspicion has been there all along. I'm sure you've had situations where people report, even in Ghana, that someone called them to change their ticket, their certificate, and blah, blah, blah for them. And the airlines check that, but of course you cannot be sure. That's why we have introduced something we call the Panabias.
Right.
Which checks the authenticity of the report you are holding. Both, if you are coming to the airline, is obliged to have a check through that software, because we have registered facilities who, and lab technicians who can sign. And also, when you sign, you put the database, which you can cross-check. So all those things are measures in place that is helping us. That was put in place about a week ago, signed by the Minister of Health. I think there was a circular press release on that matter. And so that one is also a way of checking that. But like I said, the incubation period is 2 to 14 days.
Right.
So someone may be incubating at the period all the tests were done. Only to arrive to be positive. Okay. And when you are becoming positive, it doesn't take a day or two, it may just take an hour for your status to change, because it's a multiplication of the virus. If you reach a certain number, you test positive. And so really, the fact that you tested negative yesterday or even this month doesn't mean that you test positive.
Right. The question I was actually going to ask about the tests that they are doing before they come to Ghana is that, have we noticed any sort of trend? Which countries are these dubious tests coming from the most?
Well, I think we identify a few, and a few of them, but it's all over the world. Not that many, but we cannot say that this particular country they are victorious for that. But you see, it's more of an individual thing. You see once in a while a few people who are coming with suspicious PCR tests.
But are we collecting that data, as in, which countries?
Oh, yes. What we have all that data. We have those people who come in with antigen tests instead of PCR tests.
Yeah.
And for those ones, the airlines are fine for not accepting an antigen test or a PCR test.
Right.
Or if someone comes in and has a negative PCR test at all and it's on the plane, or PCR positive and it's on the plane, the airlines are fine. So they are very strict in checking to sure that people don't get bought.
So from the data you've collected, which country is the origin of the largest number of these?
I think you have asked this question several times. I said it's all over the world, and I cannot think of any country and say this is the more materials with it. It's all over. We have them from other places, a few once in a while, we pick from all places.
Do we know which strains they are testing positive for?
We continue to do our sequencing. All those who are positive at the airport, we take their sample and do the sequencing. And we continue to check. We have not seen anything new apart from the UK strain and a few South African strains and the original strain that is here. And so once there's Noguchi and Posavandas speak up, as they segregate their report periodically, if there are any new trends, we'll be alerted. But so far, we have not seen any strain that we don't already know already. So that's what it is. So that sequencing continues to go on. It's actually been expanded to do more even within the country. So all those who are tested on arrival at the airport your samples are taken for sequencing.
So at the moment, we're keeping all the positive cases in isolation. And,
Yes.
A few days ago, we had 75 in one day. If the numbers keep going at this rate, do we have the capacity to house them
Well,
all?
I think we will have to escalate our capacity because I think the cost of letting people who obviously are known to be positive into the community is much, much higher than the cost of keeping them.
Yeah. So how many people do we have in isolation at the moment from the airport tests?
It changes. Some may have been discharged today, so I really cannot. But obviously, we have more than 100 plus.
Right.
In the hospitals. But it changes. Today, some of them will have reached their first day, they tested negative when they are discharged. So it changes by day.
So you mentioned that at the moment there is this incubation period, which means that there might be some people. Yes, there might be some people who will test negative at the airport, but a few days later they could test positive.
Yes.
Bearing that in mind, does that mean there's a possibility that some of the these positive cases will have ended up in the community?
Oh yes, and that's why that's why we ask them to self-isolate. But we know they don't do that, and that's why we keep those who are obviously positive. We follow them up, and we want to follow up a few of them to go and test them and see how they're faring. And like I said, it's more of a risk reduction, not elimination. The only way you can eliminate that is to close your borders at the airport. Then nobody will come in.
Okay. Right. So
we already have a community transmission. So it is something that I think our community surveillance system we should be able to identify. And some of them end up sick, and we test them and they are positive and follow them up. So it's fine.
When did we stop asking people to self-isolate? When did we start this process of keeping them in isolation under government supervision?
No, I think it was the first one where everybody was positive negative was quarantined and tested. We followed up with self-isolation. We followed them up. We saw that people were not complying. And so way back in January, we instituted a measure where all those who test positive are detained.
So we've been detaining positives since January?
Yeah.
Right. Nobody has been asked to self-isolate since January?
No, the self-isolate, if they are negative, general information because have just come in, please self-isolate and all the protocols. But we know that many people may not do that. So we do follow up the region where you are in has information about you, and so they need a few phone calls to check how you're doing.
Right. Is it possible for us to? I know we've been fining and sanctioning the airlines that bring in antigen tests, but can we? Is it possible for Ghana to set a certain standard for the type of test we accept? And if the airline doesn't meet that standard, then
it's PCR. For travel, it's PCR. So that one is there. It's PCR.
So
that's what you do.
Oh, okay, but well, I mean, we're still getting these positives coming through. Should we be more specific?
It's PCR, and that's why with the panel bios, we have accredited labs where labs of this standing where these tests are supposed to be done, signed by accredited lab technologists, so that they can verify and ensure that. And when they do the test, they are put in a network system where you can actually verify the results. And so these are all additional measures that tend to go and reduce the tendency for people to falsify their results and coming.
Okay, now, Dr. Aboagye, we know that in certain jurisdictions, they do not allow, flights from certain countries into their jurisdiction. Since you've talked about knowing the countries that, these cases are coming from, have we considered, for instance, banning people from certain countries from coming into the country based on the COVID-19 cases in those jurisdictions?
Well, as a service, through our minister, we continue to publish our data. And I think there are decision-making bodies that's what we are assisting coming on the record. For us, we don't see the need to ban any country from coming, apart from enhancing our measures to prevent any excessive importation from any hotspot in the world.
So you mentioned
but I'm sure there'll be a travel advisory that alert people periodically, and these are the areas that you have to be careful if you are going, and etc. I think these are things that are part of the system we do all the time.
Right. So you mentioned that it's possible that some might slip through because of the incubation period. So how is our community level surveillance going? Do we have the structures? Do we have the contact tracers and everybody in place so that if, we can track any variants that might turn up?
Everything is in place since we started last year and actually expanded. Now we have about 30 labs doing PCR tests. We have our districts the rapid response team that does their contact tracing. If somebody is positive, you ask them about their contacts and you pull them up and check them. And that's what determines the total number of tests. And that's why when the numbers go up, you see more tests being done because you're pulling their contacts. Now we are reporting a little under 100 sometimes, apart from because of the airports, that's why we move about 129, particularly 31 or so in Accra. And a few 2, 3, 10 here, and then the next 16. And so the numbers are low, but it doesn't mean we should be complacent because with the surge in other countries, it is possible that our neighbors have a surge and we also have some positivity. So we need to ensure that all the protocols that have been in place remain in place and spread them so that we can still continue to enjoy the relatively low prevalence that we enjoy now.
You've mentioned that we need to be vigilant because there are surges in other countries. India is an unfortunate example of such surges. In their country, part of the reason why they are facing the crisis they're in is because of a lack of facilities to treat those who have it, like oxygen.
No. That one is the response. Not the reason why they have the surge. The response.
Right. So the fact that they are unable to treat them is not accounting for
leading to a lot of death.
The deaths, yes.
And I think we had our own examples January, February this year.
Yeah.
And so if you don't prevent. We all don't work towards prevention. When we get to a stage, no health system. France was overwhelmed. Germany was overwhelmed. So no health system can withstand if you have thousands of people turning positive. And so that's what we must guard against.
Yes.
Because no matter what country you are, if you get to the surge becomes so much, your capacity will overwhelmed.
So back to my question. Obviously, a lack of facilities is a part of the reason why they are going through a crisis. And I'm asking what our provisions are. I mean, we don't want a spike, but if we end up with a spike, do we have all the facilities in place, oxygen and all the beds and everything that will be needed to manage any large numbers?
I will not say all, but we have significantly expanded our capacity to manage.
Okay.
But like I said, if we started with 11 beds or 12 beds, I should remember, but we have beds in all regions to manage both severe cases and mild cases. And despite the low numbers, all those facilities continue to remain active. They continue their training. They are building better capacity there. Should there be any upset, we are better prepared than we were earlier. And so that's what we are doing. But like I keep saying, if we don't follow the protocols and we allow a surge, no country has the necessary resources or beds and staff to manage a massive surge. And that's what every country, and I'm sure you follow the news, you've seen bigger countries where they have to queue beds because there's no bed. And that's why we must all, both media, health workers, and the young population must work against.
You're right. We really need to be careful about following the protocols. How do you think Ghana is doing there in terms of all the directives from government, not to organize events, not to go to beaches, to wear our face masks? How do you think we are doing currently with all of these?
Well, I think you can look at the Easter. The measure that was put in place averted a surge, unlike what happened in Christmas. Okay, and so the fact that people compliance and the effects that are put in place are all helpful and ensuring that we don't get surges.
There are some who are of the view that we are relaxing our protocols. Is that the observation of the Ghana Health Service?
Yes, it is true that people are relaxed. And that's why we need media like you to continue helping us in the messages of that we are not out of the woods and that people must continue where they are following the protocols. And I believe that it is. And we hope that more people will abide by the protocols than we are doing now.
I mean, if this is the observation of the Ghana Health Service, what's the recommendation or what is the action being taken to ensure that we don't end up with a surge?
Well, we are doing a lot of community engagement. We've seen, there's a lot of multimedia advertising among others, but you also see there's a lot of community engagement in the regions, meeting chiefs, opinion leaders, and working with religious leaders on the measures in place. And so these are the things that we're currently doing and continue to do, even in a time that we don't have such a massive stage.
Yeah.
So that we don't lose that.
So while you're managing the spread, you also have to be managing the vaccination program, which started off with the AstraZeneca vaccine, and also we received some Sputnik V. What's the status of our vaccination program right now?
Well, I think we have, as you are aware, we have vaccinated almost close to 100,000 people. Let's say, Alexander, that.
Hello?
Yes, we vaccinated also, and that number. And we are actually working towards the second dose. People need just the second dose, but we now vaccine to give people more first dose. And so that's what we are working on. And like I said, because you know that getting a second dose around 12 weeks gives you better boost. You are extending on now, which was the earliest time any medical say a vaccine to move to 12 weeks.
So when are we getting more vaccines?
When I get the date, I'll let you know.
Okay, so you don't know at the moment when we'll get more.
We know that we get some in May, and when I get the date, we'll let you know.
Right. Do you know where they'll be coming from?
If you come from anywhere, from COVAX, from bilaterals, from individuals they are engaged in. So when they come to, you know.
So we don't know where they'll be coming from. Right.
We have multiple engagements so far. Whichever one is ready, and they will come in, and they will let you know.
Okay. All right. Thank you very much for that, Dr.
Thank you very much.
Dr. Patrick Kumar Boaji is the Director General of the Ghana Health Service. So, I mean, I wanted to exhaust our questions for him because he has a meeting that he has to attend. But now that we've heard from him, Kwame and Dr. Beo, I'm keen to hear your thoughts. If you don't mind, I'll start with you, Dr. Beo. All right. Dr. Beo is in his office, but I think we're struggling to get the connection, which means you're up, Kwame. I know you were listening.
Yes, I mean, there's a lot of positives in what Dr. Boaji said.
I don't know.
The point you have to realize is that whatever we do at the airports, because of what we call the latent period, which is the time between which you get infected and the time at which you most likely would have enough viruses in you to test positive, being 2 to 5 days, there is a small likelihood that some people will pass through the airport. And therefore, it is good that they are going further to monitor people who've actually tested negative and are going into Ghana. The only concern I had was with the countries that he doesn't want to put across, because if you look at other places like the UK and other things, they've got what they call the red list, and they've got a traffic light system. So their travel advisory will tell you, don't go to this country, or with this country when you're coming, when you get here, even if you test negative at the airport, because of the latent period, you'd have to be quarantined in a hospital, in a hotel for 7 days and stuff like that. And there are others that will be followed up. It is important, in my view, that the citizenry know these countries so that they are reassured about the checks and balances going on there. Because like Dr. Boaji rightly said, this is about risk minimization, so that if anyone felt, and I had been saying this right from the start, and I know Dr. Bayer had been saying it previously on programs we've appeared on, that the airport was foolproof. There you have your answer. It was never aimed to be foolproof, and it never would be, because of the nature of this virus and its life cycle. So for me, until we get ideas around when we're getting vaccines, the best thing is protocols. That's the only thing that would foolproof some of the things for us and mitigate against any risks of people getting through the airport. So yes, I listened to all that, but with the vaccines, it's rather unfortunate that probably the might not even be realized, just because of all, unfortunately, globally, all the companies that are manufacturing the vaccines for Africa are Indian situated. You've got Serum Institute who are doing AstraZeneca. You've got, Biological E who are doing Johnson & Johnson. And you've got 3 companies who are doing Sputnik. They are all in India. Now that they are going through a surge, this is one of the reasons why the Indian government is saying they don't want a total lockdown of the country. But you have to also bear in mind that because they're having a high surge, it's going to affect their workforce turnover, which means that production is severely diminished. I mean, I've seen correspondence from Serum Institute saying that their production has diminished to about 9% of their daily production. So that would have an impact on how much vaccines India can get, because India has already imposed a ban until such time that they have vaccinated enough of their people before they allow export. Now, that period is going to be longer because Serum Institute is producing less. And that is going to impact on the global supply chain. So that is a bit of a concern for me. But unfortunately, like I said, there's not a lot our government or any other government can do about it. It is just what it is. And we just have to learn from it and continue to abide by the protocols.
Well, I mean, you've made the point that that can never be enough. No country can get out of this without vaccines. So if our reality is that there's nothing we can do about our inability to get vaccines, it sounds a little bit to me as if, well, we're done for. Am I exaggerating?
No, I wouldn't want to say we're done for. Rather, what I hope and would happen, and like I said yesterday, I monitored Bill Gates' interview, and he holds the same view. What we should hope and pray will happen, like, for example, now the UK has got to 61% of its population vaccinated. Very soon, if they get to, because today, as I was on air, there's been an announcement for people around the age of 40 to start booking appointments. Already there's a queue on the appointment booking system. If countries like that are able to get through, the United States is moving at pace as well, they would then be able to supply some of their excess vaccines to COVAX. That would ease the supply chain. That would also imply that Europe would get more vaccines because the vaccines that are coming out of Moderna and Pfizer would then start supplying Europe. If India then gets out of this current uptake, Serum Institute will start producing, what do you call it? Biologically, will start producing, all the three producing, Sputnik will start producing. That would increase the supply chain. So what we need to pray for is for these countries to accelerate their vaccination drives to a point where they hit herd immunity. Already, UK has hit it by the first dose. Israel has hit it already.
Yeah.
If we don't get these countries there,
actually,
I'm sorry, but the vaccine nationalism is not going to stop. Like Paul Kagame said, we are not going to get vaccines by goodwill alone. We are only going to get vaccines if the supply chain eases up. And that is something that we have to just accept, unfortunately.
Right. Dr. Bayo, I'm hoping our connection, our line is a bit better with you now. Yeah.
Line is a bit better.
Earlier, you were explaining to us about what's happening in the community, at the community level. We're not seeing any spikes. The numbers are going downwards. But the reality is that our airport, like Kwame says, is not foolproof. So what are the provisions in terms of your staff members and their ability to handle any increased numbers? What do you need, or are we okay? Are we set and ready in case these numbers go up?
So, Kojo, no health system can be okay enough, just as Dr. Abuaji said. No health system can be okay enough. And so our best bet is the continuous prevention. I would have, like, from his take up a lot of positives. And I think the fact that the airport is taking these things up itself means that the system is working. And mandatory isolation will also be helpful. But the only thing I felt that should have come out a bit better in his presentation is the issue of the vaccine. I think we need to accept our fate as it is, as Kwame is saying, that we are not getting these vaccines anytime soon, and that should come out clearly. And this then will inform our behavior in the community. If we keep giving assurances, it will come in May, but we don't know which country, we don't know where it's coming from, but it's going to come, then we are in a state of hope that is not substantiated. And then for people then may behave in a particular way, thinking that, look, these vaccines are going to come anyway. And the trend we are seeing in the community where the prevention protocols appear to be going down may continue. I think that let the people know that, look, there's a global shortage. We are not likely to get the vaccines anytime soon. Our stipulated time for the second dose for other people, we may not meet it. For the rest of the community waiting for their first dose, you may not get it. And if we know that this is a situation, or it might delay significantly, then we will tackle our prevention very seriously. Such that our enforcement of the various protocols then should be very, 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 very stringent. And then in terms of our capacity, I will tell you, we have an increased capacity now. The window we saw in January, we improved our capacity significantly. But that is not a foolproof assurance that should we escalate again in the cases, we can handle it. No healthcare system can handle this. So we should all work at the prevention.
Right. When we come back, and by the way, we're talking about COVID-19. We've cited a letter from Frontiers to the Ghana Airport Company warning them of increased numbers of positive cases at the airport. 75 cases recorded on the 24th of April 2021. We're talking to Dr. Titus Bayo, who's the Deputy General Secretary of the Ghana Medical Association. We're talking to Kwame Sapon-Asiedu, who is a fellow of CDD and a pharmacist. And we're trying to understand a few things, particularly where Ghana stands in the global picture. We've seen what's happening in India. Could that happen in Ghana? When we come back from these messages, we're going to find out from our guests. Also, we're going to find out whether government's communication on the management of COVID could be better or whether it's at its best. All that after these.
Dear Kochu,
Dear Abuna,
we have everything.
but I have one question for you.
What happened to our love?
Roverman Productions presents Uncle White's third Matter Day webinar, What Happened to Our Love? Date, 2nd May 2021. Time, 5 p.m. to 7 p.m. sharp. Venue, online via Zoom. Register at www.rovermanproductions.com. All participants stand a chance to win a large pizza from Cheesy Pizza or 10% discount on all weekend packages at Exim Beach Resort. Roverman Productions, be the difference.
Babe, so what are we doing tomorrow?
Oh, I have to go to the bank, then go and pay for the stuff for my place. Then maybe back to the bank to transfer what's left to my brother. So
Are you serious? You're going to the bank twice in one day? Who is she? Eh? Which bank? Which branch?
Oh, babe, but
Oh, don't babe me. What's her name? Tell her what.
It's a new day.
Make your life easy with CarBank mobile banking. Just dial *771#, and just like that, your life is easy. Transfer money from your CarBank account to any other account. Do mobile money and other payments right from your bank account on your phone, anytime, anywhere. No internet, no charges. It's just that easy. *771#. Banking is easy with CarBank.
CarBank, forward together.
CarBank, forward together.
The cousin that hogs all the food. The relative who's always late. The brother who's always on the phone.
Hello, let me call you right back.
The niece who's allergic to everything.
No, thank you. I'm allergic.
The work buddy that finishes the last of the Coca-Cola. We all know one, but meals wouldn't be the same without them. Savor moments together with Coca-Cola. This advert is FDA approved.
Do you have a property for sale? Your property may need professional management. Do you have accommodation to rent out or simply looking for a place to rent? Renters Paradise, your professional landlords, offers you the best property management consultancy and services. Call us on 0551 955 366. Find us on Facebook, Twitter, and Instagram at Renters Paradise GH. You can also visit our website, rentersparadisegh.com. Renters Paradise, your peace of mind assured.
Why do you allow coughs, cold, and flu to ruin your happiness? You need Summerlin Cough Syrup. Summerlin Cough Syrup will relieve you and your family from coughs, cold, and flu. Summerlin offers a whole range that provide relief for the entire family. Insist on your Summerlin in pharmacies and licensed chemical shops. Summerlin Cough Syrup from Danex Itin Starwin PLC. If symptoms persist after 48 hours, consult a physician. This advertisement has been vetted and approved by the FDA.
Hey, bro,
Kofi, your ceiling be smooth, bright and fine, Papa.
That's an understatement. It dey blink like 80 karat white gold. This be Interface plasterboard ceilings. Smooth, bright, and long-lasting. Everybody wey dey come here, they feel am. Where they direct them go Interface Limited for world-class quality.
If you're involved in new property development, renovation, or decoration, the right place for you is Interface Limited. Call us on 0274 999999 or visit our website at
www.interfacelimited.net. Facebook, Interface Limited GH. Instagram, interface.limited.
Coronavirus, COVID-19.
Coffee in your cup and Joy on the set. The Super Morning Show is always the best bet on Joy 99.7 FM.
Anyway, you're welcome back. Oh, the things we talk about during the breaks. It's the Super Morning Show on Joy 99.7 FM. And we're having an important conversation about COVID-19. We've cited a letter from Frontiers to the Ghana Airport Company, and it's highlighting the increase in positive cases at the airports. What does this mean? And should we be worried, even though our numbers are actually on a decline across the country? All right, that's all to come. First, though, good morning to all of our friends at Robert and Sons Optical Services. Every time you see me wearing glasses, it's thanks to them. Today is no exception. So give your eyes the best attention and care it deserves this year. Don't play with your eyes, crap. Visit Robert and Sons Optical at Adenta, Weja, Adabraka, Usudankwa Circle, Tema, East Legon, or in Kumasi for comprehensive eye care and 100% original and unbeatable products for both children and adults. Also, go and visit them for the state-of-the-art optical coherence tomography testing service, OCT, that's what they call it, or retina damage detection scan. I have to do that very often because of the diabetes. So far, so good. All right, Robert and Sons Optical provides services to members under all the major private insurance schemes. So call them on 050-151-9111, or you could try 024-008-4437 for more information. Or just go to the online shop. It's robertandsonsoptical.com. They're on Facebook, Instagram, and Twitter as well at Robert and Sons Limited. Robert and Sons, seeing is believing. Visit Robert and Sons Optical.
Great. So Top Tech Ghana, a road safety transport and logistics company, together with its stakeholders, invites transport officers and drivers of organizations and companies of corporate Ghana to attend a 2-day training program on defensive driving at its conference center near the General Hospital on Thursday 29th and Friday 30th April from 8:30 a.m. to 4:30 p.m. Now, the theme of the program is reducing road crashes within corporate Ghana. Top Tech is 25 years old and is giving a 10% discount on all of its services. You can enroll by calling Top Tech on 055-320-4099. You can also register online at toptechghana.com. Top Tech is an ISO certified company and will issue ISO certificates to all participants after this program. All COVID-19 protocols will be observed. Top Tech is outsourcing trained drivers to companies to reduce the carnage on our road. Top Tech, quality in every move.
Right, so the Ghana School of Law presents the 16th edition of the Akoto Memorial Lectures under the theme, The Legacy of Bafo Akoto, a family man, chief, and statesman. The event, which is organized every year as part of activities marking the SRC Week celebration of Ghana School of Law, is happening on Wednesday, the 28th of April, 2021, at the Great Hall, KNUST, from 10 a.m. The keynote address will be given by Dr. Owusu Akoto, who's the Minister for Food and Agriculture. The special guest of honor is Professor Aaron Michael Kwe, he's the former Speaker of Parliament. Now, other dignitaries will be Mr. Maxwell Upukwa Jiman, Acting Director of the Legal Education and Ghana School of Law, and renowned economist Mr. Kwame Pienim. This event is under the auspices of His Lordship Justice Indin Yeboah, the Honorable Chief Justice of the Republic of Ghana, and the management of the Ghana School of Law. A major highlight of the event will be the reenactment of the famous case, Akoto and 7 others. This program will be broadcast live on Joy News, Joy FM, and all its social media handles.
Well, so you can do more with Absa Digital Banking in a flash. You can make free instant money transfers, free mobile money transfers of up to 100 Ghana cedis daily, pay bills, buy airtime, Make payments with your ABSA vertical card and also make cash deposits on our ATMs. Enjoy convenient banking as you stay safe with your loved ones. Remember to sanitize or wash your hands after the use of any e-banking device. ABSA cares. Stay safe. For inquiries, visit absa.com.gh. Terms and conditions apply.
They do indeed. All right, so let's get back to our all-important conversation. Our guests, Kwame Sapon-Asiedu and Dr. Titus Bayo, helping us understand where we are, where we stand with all of this. Now, let's talk about India. What we're seeing there is scary, is devastating. There are some who suggest that all of this is happening due to a fact that they kind of froze when it came to implementing some policies. So we know that they were supposed to invest a certain amount of money in their own COVID case management, in their own research, in their own vaccines, because the vaccines they manufacture do not belong to them. They belong to the pharmaceutical companies. But for some reason, all of those decisions either did not get made or they got made but did not get implemented. Now they have this massive shortage of staff, beds, and oxygen. It sounds to me like the situation where your neighbor's beard is on fire and we need to be fetching our own water. I want to start with you, Kwame. What are the lessons we should be taking from India, and how does what is happening there affect us here in Ghana?
Thanks, Kojo. It's interesting because yesterday I was invited by some colleagues who are from India onto a Clubhouse forum discussing the learnings from India. And two things happened in India that have brought them here. The first one was the fact that they just came out of an election where they had massive rallies and all that. But before that, they had banned all religious activity. And the religious, India has very strong religious undertones from the Hindus to the Muslims to the Sikhs and all that. And they were all in some form of compliance. But when the political activities went on, then they turned around and said, well, if you can hold rallies like this, and it's not going to cause a spike, then we are going to hold our activities. So 3 weeks ago, there was a massive dip by the Hindus in the Ganges River, which is one of the biggest activities in their religious calendar. It was on CNN, it was on BBC and all the news channels. So they had one super spreader event followed by another. Why have I drawn people's attention to that? We had the same thing in Ghana in November, December, and then it led to January because we had one super spreader event, which was the crescendo in political activity. And then we had Christmas with the religious people saying, well, if we can have this and it's not, then what happened? We saw it. Fortunately, we learned our lesson and we held ourselves in check at Easter. I am just hoping that we will not develop fatigue and moving into activities, we would not start getting into small silos, because the concern then is if you are getting people coming in who are traveling, who are the most likely to have gone through the airport during the latent period, they most likely are middle class and upper middle class people. And normally we would go into small meetings and other things in joints and places like that. And that could then lead it into workplaces. That is something that we need to seriously work against. The small gatherings that can be the beginning of community spread. If we are able to control that, while the uptick goes on in India now, it started in Thailand and it started in Pakistan as well. We shouldn't forget Brazil is going on and Europe is now out of the woods here. If we are able to control our community behaviors while this global spread goes on until the downward trend starts, then we would have controlled the possibility of having another spike in the country. If we don't, then I'm afraid our chances wouldn't look good.
Right. So, Dr. Bayo, one of the reasons why people are dying in large numbers in India is because of a lack of oxygen. It's become so bad that even on the black market, people are having to pay about 10 times the cost of oxygen just, to get themselves a cylinder or two to save their loved ones. The BBC reports a woman's very sad story of how her father was dying from COVID. She had to go and buy an oxygen tank, which cost her almost $500, a lot for a woman in her economic situation. And then her mother also, started having difficulty breathing. And she didn't have the money to, buy another cylinder. And she now has to decide between her father and her mother-in-law, who to save. Are we in any danger of having that kind of situation if our numbers suddenly go up? Do we have Dr. Bayo on the line? Right, it seems we've lost Dr. Bayo there. But while we have Kwame, we have Dr. Bayo now. I think you have to unmute your microphone, Dr. Bayo, so we can hear you. Right. Forgive us, we're trying to connect to Dr. Bayo there. Can you hear us? Right, that's a bit of a difficult connection. All right, let's continue with Kwame while we try to reconnect to Dr. Bayo. Quick wrap up from you, Kwame Sapon. Said a lot of questions are coming through. Some people want to know if at some point the vaccination that we've got, the first dose, will expire. I think we heard earlier that the amount of protection it gives us might go down, but science hasn't yet told us when that will happen. Can you take one vaccine and then go and take another as a top up? For example, AstraZeneca first, and then you go and take Sputnik V as a top up, if that's what's available.
Thanks, Kojo. Two things. The data on the longevity of protection is available and is evolving. Currently, there's data up to about 24 weeks. But there is data that the data you can trust goes up to about 16 weeks. I have said, and I think Dr. Abuaji confirmed the last time I was in a similar program with him, that the only way we would know in Ghana is if we try as much as possible to monitor the antibody levels in people who've already taken the vaccines. Because as long as we are monitoring the antibody levels, we would know if the antibody levels are dwindling. And we have to know that with vaccines, human beings from different ethnicities and races would give immune responses slightly different from each other. So the length of antibody levels in, say, Africans or Ghanaians may be entirely different from what's happening in the UK or in Spain or in India. So we would have to monitor, especially now that we know that we have no end in sight when we will get regular supplies of vaccines. We need to continually monitor to have an idea how long these are lasting. That is the first thing. The second thing about can you take one vaccine and take another? Already Sputnik has done that. Sputnik's vaccine, it's not just one vaccine. It actually is two vaccines clouded in one. It's adenovirus vector 6 and 25, which technically then means that already there is a vaccine that is using two different, forms. But because the other option, like using an mRNA and a vector, or a vector first and an mRNA is not low, there are tests going on. I know there's research going on in the UK. I am aware that the Ghana Health Service had said that they wanted to do a test like that. We would only know if we contribute to the science. And at this point, and that is why I say that we might be in vaccine constraint, but it gives our health system and our health academics the best opportunity to contribute to the body of science globally and internationally. We can also start doing research with some of these things and come up with our own information to help guide the global approach. Israel has been leading it. Israel never had any vaccine, but they've led a lot of the information that is coming from the vaccine, how much immune response we are getting, whether you can open up, whether people who have been vaccinated 2 doses can take off their face masks and all that. It's been coming out of Israel initially. Then when the UK ramped up, Public Health England then took over. A lot of the data that now is coming from Public Health England and coming from Public Health Scotland. Nothing stops the Ghana Health Service, Noguchi, KCCR, WACBIP, and the likes from churning out this information. We have the people, and I strongly believe they can, but we need to give them the will and the tools to do these things.
Thank you. Thank you very much, Kwame Sapon Asiedu. Always a pleasure to speak to you. Mr. Asiedu, of course, is Dr. Asiedu, sorry, is a fellow of CDD. He's also a pharmacist. We heard earlier from Dr. Titus Bayo, who's the Deputy General Secretary of the Ghana Medical Association. And before that, Dr. Patrick Kuma Abuaji, who is the Director General of the Ghana Health Service. Right, Churchill, Raymond, let's wrap this up quickly. Based on what we've heard, there's one thing that's on my mind. Is it really out of our hands? Kwame Sapon Asiedu says there's nothing we can do as a government right now to speed up the process of getting the vaccines. Do you agree, or are there options?
I agree. And the Director General of the Ghana Health Services own statements does not give me any confidence that we know where we are and where we are getting it. For example, it would have been we are just a week out of May. If you tell me that I'm getting something in May, I would expect that I know in the first, second, third, or fourth week, even for planning purposes, just for that purpose alone. But we know the current circumstances we find ourselves. I think he's trying to remain optimistic, which is good, and giving people hope for the future. But what we should be stressing now is that we are not out of the woods yet. So if you think that merely because you've taken the first dose, you can take off your mask and do whatever you want. If you think I still go to the beach like people do at La Pleasure Beach consistently without the police being there. The police was there during Easter. They left the place. People are massing up at the place like they used to do before. In Christmas time, that got us into trouble. So if you think you can still do some of these things, you still go to the nightclubs, some of which are still open. And I'm not sure government is checking them, but they are still open. Some of them, all of course, we're very prominent places, right under the nose of the very security agencies that are supposed to be checking them. That if you think you can do all of these and still get away with it, India is a perfect example of how things can go completely wrong with you and you not being able to manage it. Now, let's be clear. We are not having the very best of facilities. Even countries with the best of facilities suffer and struggle to contain the situation. So we are not only being irresponsible if we fail to follow the protocols. And that's why I think government should be concentrating on drumming home big time that we are not there yet, where you can take off your... Even countries that have done 60% are still telling their countries, their people that continue wearing your mask, continue remaining within the protocols we have given you, and make sure that you clean your hands and wash them, and don't do the things that will get you COVID. So that's what I think we should be stressing 100%. I am not confident at all about how we're even running this particular communication structure. And I agree, if we are being told every week that please continue following the protocols because we are yet to get the vaccines. I mean, Ghana can't do anything. Even big countries can't do anything. How much more? So let's not be overly optimistic about the situation. There's one more solution I think was possible. I don't know if it's going to be cumbersome. Why are the various facilities, that is the laboratories elsewhere, that are doing the COVID test, not sending the test directly to the airlines? So that if anybody appears there with a fake one, the airlines can independently verify, even at the point before they get people on board. I know there can be slippages, but why can't that be done so that nobody carries the test results or copies from anywhere and presents it, and we check this particular problem?
That's for those traveling out of Ghana.
No, and those traveling inside Ghana from all over the world.
They did the test, they should send the electronic.
Yes, so we know that you're going by British Airways, right? So they send it directly to British Airways, and the copy is sent to you, so that British Airways can say that this passenger on board indeed had this particular test.
Right.
Well, so if you look at the economist that Kwame Sapon Asiedu talked about, it says, Kweku Agyeman-Menu, Ghana's health minister, says he has had more than 50 meetings with businessmen who say they can get doses. A middleman from the Middle East brought 16,000 Sputnik V doses to Accra, he says. Much better would be for countries with excess doses to give or sell them to countries like Ghana. Sadly, he has received little response from such places. No one is listening, he sighs. And that's important. No one is listening. So that actually tells you, and tells you and I that that's our situation. And I think we've reached a stage where we need to be told that, look, this is the challenge. The Director General of the Ghana Health Service is giving indication, says, this is the challenge that we are faced with now. So all of us who think that, okay, well, I've taken the first dose, I'm taking the second dose, and at least I'll feel better and all of that. I know that, well, all things being equal, I'm not going to suffer, you know, the kind of effect that COVID-19 had on other persons. Please start rethinking. And what that means is we must go back to the protocols, and government must do a few things. Yes, we've opened our airports, but I also think that, look, countries that have lots of cases, we should stop them flying into our country. In other jurisdictions, it is done.
Yeah.
You know, we just don't say wholesale, everybody should come in. More so when we know, based on the countries that are actually coming with lots of cases, we have the evidence. Let's use the evidence to work things and make them right. For me, that's very important.
The evidence we are unwilling to share with the public.
You see, that's the thing I'm very surprised about, that he said that's not for radio. I wasn't sure why. It's the kind of thing that you would need to know.
It may inform where I want to travel to.
Exactly, exactly. You might make a choice not to go to a country where their PCR tests are not trusted, you know. But anyway, let's see how that all unfolds. I just before we take this break, very quickly, I think that Ghana really needs to focus on getting data. That might be our bargaining chip, the thing that we can use to trade for vaccines. You know, we missed the bandwagon when it comes to manufacturing vaccines. You know, we decided not to participate in any trials. So this is it, data. Maybe that's our way in. We should think about it. All right, let's take some messages, and when we come back, even more, we'll do our Drive Safe campaign. It's about speed ramps and bullets.
After 30 years in business,